Good afternoon.
Good afternoon.
Joke's on me, I went to the wrong location. But I'm here. So welcome to the School of Public Health, Spring 2024 Doctor of Public Health Commencement and Hooding Ceremony. Today we're celebrating the accomplishments of 6 DrPH graduates: Lee Alderman, Elizabeth Fallon, Michelle Marcus, Stephanie Meredith, Tony Price, and B. Salvinson Von Essen. To the class of 2024, I'm pleased to host this ceremony to mark the end of this journey to obtaining your DrPH degree, and I extend my heartfelt congratulations to each of you. For many of us, the journey to obtaining a doctoral degree is full of countless trials and tribulations. In reflecting back on my own journey, I'd like to share a short story about your dean. And just remember, I'm human too. So while I was trying to finish my dissertation here at Georgia State many years ago, like many of you, I was working full-time. I was also stepping into a new level of professional leadership that was extremely demanding for me. And add to that the juggling of my responsibilities as a new father. I really just wanted it all to be done. I just had so much going. My dissertation chair had also recently left Georgia State for another institution, though he continued working with me, co-chairing duties with another faculty member. I was feeling overwhelmed with everything that was going on: parenthood, work, life. My thinking at the time was simply, quote, I guess it's not a quote, but it's what I was saying. Everyone, me and my co-chairs, just want this to be over. So that's was my thought. So I will admit, this is the human part, that I submitted a half-hearted draft of my dissertation, just hoping it would just be enough. It was not. To this day, I remember the piercing response I received from my chair. Quote, "Rodney, I am stunned that you would submit a draft of such poor quality. This is far beneath your ability," end quote. My heart just skipped a beat just reading that. It still hurts today. It was like a parent saying, "I'm so disappointed in you." So I was humiliated, disappointed in myself, and it was really a low point. And perhaps you've had your own low point in your journey. But after a week of sulking, I started to see a positive. My chair, despite the distance, not only cared about the product that I was working to produce, but also believed that I was capable of so much more. And I knew he was correct. For the next 2 months, I stayed at the office late, working until 10 p.m. 3 nights a week to get my next draft developed. When I submitted the new version, my chair responded, quote, "Now this is the work that I knew you were capable of. You're ready to defend." Oh my gosh. I'm forever grateful to my chair for believing in me, not allowing me to settle for mediocrity, and pushing me to realize my full potential. So when you look back on your own journey, whether your dissertation chair was a person that you've come to love and hate, someone who was often standing in the way of your artificial, even delusional timelines for completion, I sincerely hope that you'll always know just how much they believed in you. At this point, I think it's important that we give chairs a round of applause. Can we show some love to the dissertation chairs? Graduates, I hope you've learned through this process that you're capable of so much more than you know. As you continue your journey, remember just how much your advisors and mentors believe in you. And never forget you can always ask for help. New challenges are on the horizon, but there are also opportunities for new training and new learning. And that's because the best version of yourself is still being developed. So graduates, I wish each of you Congratulations, and may your future be filled with all good things. At this time, I want to invite Dr. Harry Hyman, Director of the DrPH program, to the podium. Dr. Hyman. You can welcome him.
Can we turn down the lights now? Good afternoon. Oh, come on. Good afternoon. Good afternoon. There you go. Thank you. And thank you, Dean Lynn. As director of the DrPH program, it's my honor and pleasure to participate in today's commencement and celebrate our 6 program graduates, Lee, Beth, Michelle, Stephanie, Tony, and Bea, and really excited that it's such a long list. This is the largest group of DrPH graduates we've had. 6 years in, we're finding our stride. So, as I know you all recognize, today represents an incredible milestone. Fortunately, only one of you got put through the paces by Dean Lynn. Whether or not you were put through the paces by your own chair, we'll kind of leave to the side. Don't talk to Bea about that, please. As you join the growing group of Georgia State DrPH graduates, it's amazing to see so many of your friends, colleagues, faculty, and family members who've shown up for you today, both in person and on the live stream. Together with them, we're extremely proud of your accomplishments. As I've mentioned at previous graduations, preparing the next generation of public health leaders and champions for health equity is a charge that we take seriously. Each of you represent a powerful proof of concept for helping us to achieve that collective goal. Each of you are already public health leaders in your own rights, meaningfully engaged in the work of advancing health equity. Lee, the light's bright, so I'm trying to, all right. You were one of the brave members of our first cohort of DrPH students. Thank you for your courage in both persevering through our growing pains and providing critical feedback to help us move the program forward. As I look at your DrPH journey, there's one word that stands out: collaboration. I know that pregnant pause, you were wondering what that was, but only for about a millisecond, which you uniquely understand is the critical process that underlies the multidisciplinary and multi-sector work of public health and the ways in which we engage with partners and communities. Your dissertation helps to move the needle on defining exactly what collaboration is, how we can differentiate it from other ways of working together, and through the tool you developed, how we can measure it in meaningful ways. That work is a critical building block for addressing the complex and challenging problems we all face ahead. Beth, we all know you didn't need another degree. Do we call you Doctors Fallon? It should be clear to anyone and everyone that you not only have the credentials, but the broad and deep expertise to do whatever you choose to do in the field of public health moving forward. Leveraging your expertise to ask critical questions and to perform complex analyses, even analyses that impress our beloved Dr. Hyatt, are clearly your trademarks. Your applied practice experience at the Georgia Department of Public Health was the first time anyone looked at asthma surveillance data in a way that highlighted the relationship between uncontrolled asthma and social determinants of health. A project, by the way, that you requested to do as an add-on to the original scope that they outlined for you. Your dissertation looked at the role of mindfulness on physical activity in Black women with arthritis, both an important question and an intentional focus on a previously understudied population with important implications for health equity. Michelle, as a health impact and health and all policies expert, you have been a wonderful thought partner and teacher to me. I still remember the first day of our urban health class, when I acknowledged to everyone that I really wasn't a subject matter expert, but that fortunately for all of us, you were. It is your profound depth of knowledge and experience combined with soft-spoken humility that make you such a powerful partner and bridge to communities and community-based organizations. I'm hopeful, and now I'm glancing subtly at Dean Lynn, I'm hopeful that your dissertation work focused on identifying critical supports and barriers for community academic partnerships will become both a blueprint for the School of Public Health, hence the nod, and an important reference document for others. Stephanie, I still remember meeting you when you were wondering if you would be a good fit for the DrPH program. The answer is clearly no. You weren't a good fit. You were an exceptional fit. As someone who's been deeply engaged with the disability community on both personal and professional levels, it's been humbling to watch you bring a needed focus to inequities experienced by people living with disabilities, and to see you bring your expertise and insights to federal decision makers. You did your applied practice experience in Washington, putting together a report for the National Council on Disability on, to use your words, the promise and peril of fetal surgery and gene editing, doing a deep dive into the challenges and opportunities created by these new technologies. For your dissertation, you chose a topic that you've been addressing for much of your career, but took things to a new level, performing a policy scan and analysis to identify the policy approaches to help ensure that pregnant persons receive the information and support they need and deserve when their baby has a likely disability diagnosis. At the time of your defense, very impressively, you were already implementing the advocacy strategy to move the work forward. Tony, you were an impressive graduate certificate student when we first met, excited to translate your kinesiology expertise into public health policies and programs. Now you are truly a force to reckon with. For your applied practice experience, you worked with CDC colleagues to translate the Community Preventive Services Task Force's recommendations for park, trail, and greenway infrastructure interventions to ensure equitable access to parks and green space. For your dissertation, you assessed the ways in which Georgia laws, by design or through discriminatory enforcement, limited the ways that Black people are able to be physically active in public spaces, building on the evidence for the Arrested Mobility Framework developed by your colleague and friend, Charles Brown. Bea, as you reflected for today's graduation, the field of public health has changed dramatically since you and your colleagues started this program. I remember you sharing with me at your interview the challenging work you did in Puerto Rico, coordinating the field work as part of the PRAMS, which for those of you not in the know, is CDC's Pregnancy Risk Assessment Monitoring System, as part of PRAM's data collection to assess the impact of Zika on postpartum women and their babies in the aftermath of a devastating hurricane. Flash forward 5 years, and your dissertation used a different PRAM supplement to answer critical questions about the experience of birthing persons with the COVID-19 vaccine rollout. Your dissertation powerfully captured the voices and concerns of mothers with important recommendations to both public health practice and to clinical practice. You also opened important doors for adding more qualitative content to the PRAMs, which will undoubtedly help to improve our understanding and work moving forward. I could go on about each of them, but I won't. There are many challenges ahead for public health and for our quest to achieve health equity. But each time I celebrate commencement with our graduates, I have a renewed sense of hope. Our 6 graduates today truly reflect the leadership we need to make a difference and to help ensure a more just and equitable future for everyone. As you continue your journeys, I urge you to be bold, be willing to take risks, and to quote your colleague, Daniel Driffin, to be relentless, courageous, and fearless. Congratulations again to each of you and your families. I'd like to now call on Michelle, Stephanie, and Tony to share their reflections. And if you could come up one at a time, that would be terrific.
Hi, everybody. Well, the cool thing about going first is I don't have to worry about repeating anything that's already been said. But seriously, I'll keep this quick, but I just really wanted to make sure that I had this chance to express my appreciation to everybody that I have known throughout this program, and without whom I would not have possibly gotten through, because it really is a wonderful, wonderful group, a wonderful program that has been put together here. And I want to start by saying, not everybody knows this, but I originally did my master's here as well. In the earliest years of that program, I'm not sure, it might have been second, third year, something like that. Way back when we were still, the School of Public Health was still getting accredited and still kind of figuring out what it was going to be when it grew up. And I'm very thankful to see how it has grown and how it has matured. The School of Public Health is really doing wonderful things for Atlanta. I think it's one of the bright spots that we have in our world here. One of the places where so many talented, dedicated, and caring faculty and students and staff all come together to make a positive effect on the world, and specifically the focus on a positive effect around Atlanta, which not every program does that, and it's really something that seems to be at the heart of the School of Public Health. And so that has been one of the reasons that I wanted to come back and to do my DrPH here, because that spirit aligns with the reason that I wanted to continue my education. And I certainly hope that as the school continues to grow and strengthen, that focus will all continue to be at the heart and really drive the work that we do locally and globally. It has not been necessarily an easy road to get here for many of us. Maybe I'm understating things a bit. As Dr. Hyman mentioned, the DrPH was a new program. We have some folks here from the first cohort, the second year, and there were some growing pains, and it has been, I think, a powerful testament to the program that when we raised concerns, we were heard, we were listened to, those concerns were acknowledged and thoughtfully addressed, and we have seen actual changes come forward that have made it stronger, and that is also one of the strengths, and certainly one of the things that allowed us to be successful as we've gone through the program. And then, of course, I don't even need to mention that, halfway through our second semester, the pandemic hit, and it was an interesting time for public health, and it was an interesting time to be a student. But again, we all got through it together and adapted, and I really have so much appreciation for the way that faculty figured out how to keep delivering courses, and we all figured out how to keep participating in them in spite of those challenges. And so, I really can't, it's hard to explain how much the personal relationships with faculty and with my fellow students have meant to be able to make it through. I really don't know. I don't know how many of us would be where we are today without being able to rely on each other for emotional support, commiseration, logistical information, and everything in between. I really can't say enough about my cohort and fellow classmates as a source of strength to come through even when times were tough. And I really hope that the School of Public Health and the DrPH program in particular realizes how strong those bonds are and continues to support and strengthen them as for all of the students who are going to come along after us. So to wrap up, just want to take a moment to really express my appreciation. Sorry, I'm getting to the point where I need bifocals, I think, for the whole village of people that have made this possible. And, I think the incredible students here, I guess, yeah, they're incredible. And all of the people, the graduates that have already made it through, and those who are going to come behind, and even people who've come and gone, it's really, it's really a testament to what the School of Public Health is doing here. And then I also, of course, want to make sure that I acknowledge my partner and my family and my GHPC colleagues, and Dean Lynn and Dr. Hyman and Dr. Cormier for just all of the amazing things that you guys do in order to make this possible for us to be here today. So, yay to everybody. Thank you.
So actually, good afternoon also. So I was actually inspired to go back to school after attending the Leadership Academy at the Center for Leadership in Disability here at Georgia State. And it was there that I realized that the problems that wake me up at 4 a.m. with my heart racing are the injustices that people with disabilities face in healthcare and health services. And the reason I care so deeply is because of my own experiences as Andy's mom and seeing firsthand the discrimination that he has faced as a person with Down syndrome and hearing about stories from other families. So my reason for pursuing this degree was primarily so that I could stand on equal footing among medical providers and policymakers to advocate for better health equity for people with disabilities through leadership, policy work, and even research, which was kind of surprising for me. I didn't expect to go that direction. I'd worked in the field of disability studies at the University of Kentucky for 8 years, but when I would go to these national medical conferences to do my work, I would always feel like just the mom in the room. Until the Leadership Academy empowered me to realize that my lived experience and passion were actually my superpower. And I just needed the tools and title to harness and magnify it. And so that's when I set up that appointment with Dr. Hyman to learn more. And he assured me that I definitely would not be too old to go back to school. So even though I hadn't actually taken a math class in 20 years. So stats was very scary, and Dr. Hyatt made it less so. So I appreciate that. And I was inspired by my own mom, because I'd seen her go back to school in her 40s, and I knew it could be done. And so I met my cohort for the first time in 2020, and we had no idea what a wild ride that would be. Amidst a global pandemic, I worked full-time, I went to school full-time, and I homeschooled Lily during her 8th grade year because we had to really watch out and keep Andy safe while we were waiting for vaccinations. And ironically, I chose Georgia State because I wanted to be able to attend in person, so clearly that didn't pan out the first couple of years. But Harry was not wrong that my classmates and my professors would be the highlight of my experience. Some of my happiest memories are my side chats with Daniel and Dan in Zoom rooms and commenting. That was our strong advocacy contingent of the cohort, and studying and doing projects with the other students in the program. Still remember that first interview we had, Kiara, when we were together. And then, of course, working on my first big grant in Dr. Spears' class, and it was a Patient-Centered Outcomes Research Institute grant, which did end up getting funded with members of our program serving as advisors, so that was exciting. And of course, the joy of working with Dr. Vanosky Thomas, who has just been amazing in guiding me and being a mentor, faculty advisor, and dissertation chair. So she had to serve a lot of roles for me. And I was also able to do profoundly meaningful work in my policy class, where I was able to lead an advocacy effort to increase the vaccine prioritization of people with disabilities during COVID. So that really meant a lot. Sometimes this work, with all of that, can get dark and heavy when we're fighting global pandemics and seeing profound injustice and dealing with soul-crushing bureaucracies. But we do this work because we genuinely and deeply care about people and want to make the world a healthier and happier place for everyone. And I'm convinced we can, and we already have. And we each carry strength because of our own stories. I carry my identity as the mom of a person with Down syndrome, and I also come from a stock of Georgia sharecroppers and Kentucky miners, and my mom's a public school teacher. My dad was a machinist, making me the first generation doctor in my family. And these experiences combined with our hardworking academic achievements today and all the stories that each of you carry will give us the strength and passion we need to make meaningful change in the world. And we don't have to, nor should we, do it alone. I'm so very grateful for my family and friends that are here today and my classmates and Lily bringing me lunches while I was studying, and the Davises being our pod people when we were having to stay safe during COVID, and my husband for all of the sacrifices he gave, and my family for being here. And I know that we all have a team of friends, family, spouses, colleagues, partners, cohorts, and program members, professors, and mentors who helped us get this far, and for whom we are deeply and profoundly grateful. And they will continue to stand beside us to help us lead on. So thank you.
Trying to make sure I don't slip on this. Excuse me. Good afternoon, everyone. It is a pleasure to be in front of all of you this afternoon. My name is Tony Price. I'm a member of the 2019 cohort. I have imagined this moment for a long, long time. And I'm not just saying the length of being in this program, but literally from being in high school. One of my best friends and I used to always tell him, at some point, it's going to be Dr. Price. I don't know when, but at some point, it's going to be Dr. Price. I thought about this, and I thought about it from the time that I applied and got accepted, through all of the classes, through our comprehensive exams, through our applied practice experiences, and recently through the dissertation process. Leading up to today, there were a couple of things that were kind of going through my mind that I wanted to talk about. The first one is that in the United States, less than 2% of the adult population actually has a terminal degree. And then of that 2%, less than 7% are African American, right? And how I am only the third Black man to graduate from this program. Thank you. I wanted to talk a little bit about that, but my good brother, Dr. Daniel Driffin, he talked about that last semester, so I'm not going to talk about that. The second thing that I wanted to talk about was how when we started this program in 2019, and Michelle just mentioned it, we were here for a semester and a half before the world flipped upside down. We were here, we went out for spring break and never came back. That was interesting, to say the least. Going through a DrPH program through a pandemic was not on my bingo card that year, to say the least. But what I want to actually talk to you all about is, and I had no idea this would actually happen, what everyone else has already talked about, the people that are in this program. I remember the first day that I came to class, I showed up with my book bag, my MacBook, just getting off work, because this program is designed for us to be full-time professionals while we're doing it. I just want to put a note in that. I showed up to class, and if you actually know me and like know me as a person, you know I love this Japanese cartoon called Dragon Ball Z. I grew up overseas for a little while. I have like the stickers on the back of my MacBook. And I remember the first day of class, my classmate Dina and my friend Joel actually like came to me and was like, hey man, like I see the stickers on your MacBook. And that's how we started our conversation, right? And that's how I knew that I was in the right place at the right time, right? The second thing that I wanted to bring up about the people, the same semester that the world flipped upside down, my wife and I were actually supposed to get married. The city shut down 6 days before we were supposed to get married. We had to postpone our wedding until October, which was the month we were trying to avoid because both of our birthdays are in October. I remember we were going through putting things on our registry, and she put more of the like practical things on there. I'll give her credit for that, things that like we actually needed. I put like just random stuff on there, hoping somebody would get it. But I do remember that the first gift from our registry that we received that I put on there, excuse me, was actually from my cohort. They got us a GoPro, which is something I really wanted at the time. And I remember like, man, like these are people that really care about us and really like matter, right? The next thing, a couple semesters ago, and Stephanie, you'll probably laugh at this, we were taking a policy class, and we had to talk about a bill that was going through the Georgia House. And one of the bills that I talked about was about police behavior. And I remember talking about this particular shortcut on your phone where if you tell it you're getting pulled over, it will do this automation and let your family know and all that good stuff. This was before I was like proficient on Zoom, so I couldn't see everybody while I was giving this presentation. And I remember I was done. Everybody was crying on Zoom, right? And Kiara's back there laughing because we were all in the same class together. And I remember after that presentation, the compassion that was showed, we had to like take a break. We had to like get off Zoom for a little bit. It was like the whole nine. But I remember like in my head, that's just a day in the life of a black man on a Tuesday, right? But the compassion that was showed through my classmates is something that I will always remember and something that sticks with me. And finally, the dissertation process. When Dr. Hyman was up here lamenting about going through the process with Dr. Lynn, that was me. And I'm gonna go a little bit off script here and say, one of the reasons why I wanted Dr. Lynn as my chair is because he was actually on my thesis committee while I was in grad school here at Georgia State. And as a black man, that you have the career that I would like to model my career after, it really meant a lot for me for you to be my chair. And I remember going to your office and us talking about this topic. I think we talked about it like 2 or 3 times before you actually agreed to it. And we did it. We went through line by line, sentence by sentence, structure by structure, and we got it done. And it meant a lot to me that you were my chair from black man to black man. I appreciate you. To my classmates, I stayed in contact with them literally every day. I'm not sure that I would be standing here right now without the support of my classmates and, as they mentioned earlier, commiserating with them and complaining and just having a place to vent. That mattered so much throughout this process, and I appreciate you all so much. So I say all of this to say, and I will plant my flag on this hill, and I will call it until the end of my days. The people that have graduated from this program are currently in this program and will someday be accepted into this program, especially all of you all, Dr. Alderman, Dr. Fallon, Dr. Marcus, Dr. Meredith, Dr. Salvinson Von Essen, you all especially are the world's greatest people. I will plant my flag on that hill and call it until the cows come home. I've had the opportunity to meet real change makers. And my parents, y'all have to forgive me for this. I don't think I've ever actually cursed in front of them. But people who actually give a damn about health and about the people that are in it. This is what I came here for, and this is what I got. And I'm so appreciative to have met you all and to have gone through this journey with you all. I literally could not have imagined going through this process with anybody else. You all are the world's greatest people. To my fellow graduates, we did it. We did it. If the last month has been anything for you all, like it has been for me, it has been filled with tears, anxiety, and a sense of urgency to get across the finish line. And now that we are done, I wish nothing but relaxation, sleep, and if you so fancy, endless episodes of Dragon Ball Z to your heart's desire. Thank you, and I appreciate everyone.
Thank each of you for those remarks. Tony, it's a pleasure to work with you, and I know I speak for all the dissertation advisors / chairs in thanking all of you for the work you put forward. Let me ask you all now, the DrPH graduates, to please stand. This is the moment you've come for, so let me confer your degrees. By the virtue of the authority delegated to me by the President of Georgia State University and the authority vested to the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official records of these commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. You may move your tassels from left to right. Congratulations. I think we can do better than that. One more big round of applause for the graduates. Yes. That's better, yep. Let me invite Denise Gavea to the stage at this time. Someone took the program. Is it this one? Yes. I take mine with me. I never read it.
Good afternoon, everyone. So now, the time has come to individually recognize this year's graduates. Graduates, when I call your name, you will proceed to the stage as directed to be hooded. We will proceed with the reading of your names, and each graduate will approach the stage with their assigned chair hooder. And I'll wait for our music. Dr. Lee Alderman. Dr. Elizabeth Fallon. Dr. Michelle Janine Marcus. Dr. Stephanie Meredith. Dr. Tony C. Price, Jr. Dr. Bea Salveson Van Essen. And can I have one more round of applause for all of our graduates?
Thank you, Denise. All right, let's give one more round of applause for our graduates. Graduates, in addition to joining over 2,000 public health alumni, you join a network of nearly 285,000 Georgia State alumni. You and your loved ones supporting you along the way should be abundantly proud of your many accomplishments. You are now poised to make even greater contributions to the urgent work of advancing health equity across our nation and the world. May you continue to grow your competence, be relentless in building relationships, and be generous with your time, helping those in need. May you go forward with purpose and confidence and with a deep commitment to the critical work of improving the public's health. On behalf of the School of Public Health faculty and staff, congratulations.